Paranoid personality disorder is classified as a type of eccentric personality disorder. People with eccentric personality disorders display behaviors that seem odd or unusual to others. An individual with PPD is very suspicious of other people, which may interfere with their daily life and activities. They mistrust the motives of others and believe that others want to harm them. Additional hallmarks of this condition include being reluctant to confide in others, bearing grudges, finding demeaning or threatening subtext in even the most innocent of comments or events, quickly feeling anger and hostility toward others. According to a 2017 literature review, PPD affects between 1.2 and 4.4% of people worldwide. Treatment can be a challenge because people with PPD have intense suspicion of and mistrust of others. If you have PPD, you might wonder whether you can trust a mental health professional and feel suspicious of their motives in trying to help you. And that's okay. A mental health professional will work with you to build trust so that you will feel comfortable confiding in them and following their advice for better managing your mental health condition. The cause of PPD is unknown. However, researchers believe that a combination of biological and environmental factors can lead to it. The disorder is present more often in families with a history of schizophrenia and delusional disorder. Early childhood trauma may be a contributing factor as well. Other contributing factors include living in a low-income household, being separated or divorced. People with PPD often don't believe that their behavior is anything out of the ordinary. It may seem completely rational to them to be suspicious of others. However, those around them may believe this distrust is unwanted. A person with PPD may also behave in a hostile or stubborn manner. They may be sarcastic, which may often elicit a hostile response from others. That hostile response in return may seem to confirm their original suspicion. Someone with PPD may have other conditions that can compound their PPD symptoms. For example, depression and anxiety can affect a person's mood. Shifts in mood can make someone with PPD more likely to feel paranoid and isolated. Other symptoms of PPD include believing that others have hidden motives or are out to harm them, doubting the loyalty of others, having trouble working with others, being hypersensitive to criticism, quickly becoming angry or hostile, becoming detached or socially isolated, being argumentative and defensive, having trouble seeing why their behavior might be a cause for concern, having trouble relaxing. Symptoms of PPD can overlap with symptoms of other mental health disorders. Schizophrenia and borderline personality disorder are two conditions with symptoms similar to PPD. As a result, it can be difficult to accurately diagnose these conditions. In order to diagnose PPD, a primary healthcare physician will first ask you about your symptoms and medical history. They will also perform a physical examination to look for any other medical conditions. The primary care physician may send you to a psychologist, a psychiatrist, or other mental health professional for further testing. The mental health professional will perform a comprehensive assessment. They may ask you about your childhood, school, work life, and relationships. In addition, the mental health professional may try to gauge your behavior by asking you how you would respond to an imagined situation. The mental health professional will then make a diagnosis and form a treatment plan. PPD can be treated successfully. However, most people with the condition have trouble accepting treatment. The outlook for paranoid personality disorder depends on whether an individual is willing to accept treatment. If you enjoyed this video, subscribe, like, share, and comment.